A very good afternoon, all. It is my pleasure to welcome you all to the second session of the Health Economics Class series. Before we begin today's session, let me take a moment to reflect on the journey so far. Our first session was a tremendous success, not only in terms of participation, but also in the depth of engagement and learning it sparked. We are proud to share that it has already garnered over 500 views on YouTube, a clear testament to the relevance and impact of this topic in today's health policy and public health landscape. Thank you to everyone who tuned in and shared your feedback. Your enthusiasm is what fuels the initiative. Today, we are privileged to continue this journey with a very special speaker, our own Dr. Anish TS. Dr. Anish is no stranger to this platform or to those of us who work in the field of community medicine and public health. A widely respected academician, researcher, and a health system expert. Dr. Anish brings with him a wealth of experience in health economics, financing, and policy analysis. His ability to translate complex economic concepts into practical, actionable insights is what makes his session so invaluable, especially for students, professionals, and policymakers alike. In today's session, Dr. Anish will guide us through the key concepts in health economics with a focus on concept of cost, various types, various measures, health adjusted life years and disability adjusted life years, and if time permits, utility values, estimation methods, increment cost effectiveness ratio, decision tree analysis, and so on, building on the foundation that was laid in the previous session one. So, without further ado, please join me in warmly welcoming Dr. Anish TS to lead us through the second session of our Health Economics Masterclass. Over to you, sir.
Thank you, Binu. Respected George sir, Patmaja madam, dear friends. Before we begin, we can just brush up what we have learned so far. One is, what is an economic evaluation? Economic evaluation is the method by which we are checking whether an intervention is value for money or not. We are going to spend a lot of money on an intervention. Is it worth it? So this is a process of checking whether the spending money on a special intervention is worth it or not. So basically that we discussed was types of economic evaluation. Broadly, there are two types. One is complete economic evaluation and partial economic evaluation. Partial economic evaluation means economic evaluation is we are evaluating both cost and effectiveness for the input variables and output variables. Whatever intervention you want to bring in, the input variable will be money. Because money could be converted into human resource, money could be converted into materials. So the input variable is invariably money. So, but what is the output variable? Output variable sometimes you can measure in terms of natural units. For example, using this much amount of money, how many lives you saved? Or using this much amount of money, how many cardiac catheterization you did? All are natural units. But sometimes you cannot compare two natural units because there will be two different kind of intervention where two different kinds of natural units will be there. For example, if you have got a choice between bringing in a cath lab or a dialysis unit, in cath lab they will do the cardiac catheterization, but in the dialysis unit they will be doing some dialysis and management of kidney failure. So how can you compare the cardiac catheterization to the management of kidney failure? So here it is very difficult to compare. Then you can have a unified outcome that is known as health utility outcome, where because what we are doing by doing or what you are intent to aim or achieve by cardiac catheterization. One is you have to save lives. Second one is you have to reduce the human sufferings. But in case of you building the dialysis unit also, you are doing the same thing. You are going to save lives and you are going to reduce human suffering. So can we combine the reduction of human suffering, that is reduction of morbidity, and saving life, that is reduction of mortality? Can you combine morbidity and mortality together and you can come up with a one effect measure that could be used to compare different kinds of health interventions? So scientists are successful in bringing in that kind of a effect measure that is known as health utility measure. There are different kinds of health utility measures are there, but the most popular in health economics is QALY. It is quality adjusted life years. QALY. Quality adjusted life years means 1 year a person living with full quality. If 100 people are living 50 years with full quality, the total achievement is 100 into 50. That is 5,000 QALY. So QALY is just like how many lives you saved or how many cardiac catheterization you have done. You can just reduce or you can just combine all these things together to QALY. Then you can just, you can directly compare the cardiac catheterization to the maybe dialysis unit, again to something that you are doing in community setting, just like a reduction of a TB program. Suppose you have got here all these things, what is the context of economic evaluation? Your resources, it is scarce resource. You don't have enough resource. Otherwise, you could have invest on all these programs. But here you are not able to invest on all these programs. Then you have to choose. Then what do you have to choose? So there is the problem in difference in comparing, but the QALY is solving somehow or some part of that issue. But sometimes the interventions may be in two different fields. One intervention is in health, another intervention is in education, some other intervention in forestry. So it is very difficult to compare because the interventions outside health, it may not be possible for us to combine it in terms of morbidity and mortality. So QALY do not have a meaning there. So what we can do, we will convert into another utilitarian term, that is utilitarian or utility for all. That is your money. So you are investing 100 rupees and if you are gaining 150 rupees, what does that mean? Investing 100 rupee is worth. It is not like that you are investing 100 rupees now and you are getting 150 rupees after 10 years. No. If you are achieving 1000 rupees after 10 years, we will convert that 1000 rupees to what it means for this. If 1000 rupees after 10 years is equivalent to 150 rupees now, we will only compute 100 rupees now invested and 100 rupees now gained. So that is cost benefit analysis. So based on the outcome variable, we have got three types of complete economic evaluation. Complete economic evaluation means you are evaluating both the money as well as the outcome. So there are cost effectiveness analysis, cost utility analysis, and cost benefit analysis. How can you just check whether it is cost effectiveness, cost utility, or cost benefit? You check the outcome. If the outcome is in natural unit, it is this. If the outcome is in natural unit is what actually happened. I am not converting it to any other unit. This cost effectiveness. If the outcome is in health utilitarian term, just like DALI, QALY, then it is cost utility analysis. If the outcome is in monetary terms or money, then it is cost benefit analysis. That is by simple step you can check whether what kind of an analysis it is. That was something that we have discussed in the previous session, and we had a lot of examples and checking whether it is a cost effectiveness analysis, cost utility analysis, or cost benefit analysis. And another thing that we have discussed is Cost effectiveness analysis is used as a generic term for all these types of analysis. Sometimes a cost utility analysis may be termed as a cost effectiveness analysis. Okay. So cost effectiveness analysis is used as an alternate term for complete economic evaluation also. So cost effectiveness analysis can be three types. The really cost effectiveness analysis, cost utility analysis, and cost benefit analysis. Among these three, which one is more popular in health? It is cost utility analysis, because we are converting into health utility. Different kinds of interventions in health, different kinds of interventions in different aspects of health can be compared by using cost utility analysis. So cost utility analysis is the most preferred type of economic evaluation in health, in medicine. Okay. These were things that we have discussed in the last class. So in any economic evaluation, there are two aspects. One is the cost, and second one is the effectiveness or outcome. If you are able to analyze both, if you are able to account cost, and if you are able to account effectiveness, and you check whether the effectiveness is valuable compared to the cost. Is it value for money? This much money I have invested, this much achievement I have got, whether this money worth for this achievement. That is basically that is what we are doing in your cost effectiveness analysis or in economic evaluation. Okay. For this, doing this economic evaluation, then what we have to do first? We have to analyze the cost. Okay. Then now we are going to discuss how we can analyze the cost. Basic principles. Okay. We want mathematical calculation or no, or something like that. We will just study the concept first. Then we can do some exercise with the help of Dr. Biju George. And you can even conduct some studies using modeling and all. And you can, okay, the concept of cost. This is here today we are going to discuss the concept of cost. And if we are getting some time, we will study some part of the other segment, that is the evaluation of effectiveness, okay, because that is more lengthy. Okay, evaluation of cost is a narrow part of our topic. Okay. First, we have to discuss that many concepts in economic evaluation is evolving. Don't think that it is a hard and fast rule. If you are bringing in some aspect in economic evaluation, while calculating cost, you have to consider this aspect also. You are welcome. Okay. So you don't think these are not watertight compartments. These are philosophies. For example, what is the cost of this session? Okay, this session has got different costs. You may be giving an honorarium for me. That is one. You are actually coming here and sitting here. Okay, you may be having some other opportunity cost. You are sitting here in LA in the expense of some opportunity cost. We will discuss what opportunity cost is. What opportunity cost is? You are sitting here. Suppose you are not here. You may be doing something else, isn't it? Suppose that is the best thing that you can do using this time. Okay? For example, you can earn 100 rupees. I am going to take a session for 2 hours. You can earn 100 rupees if you are not here. What is your preference? Sitting in this class or going out and getting that 100 rupees? Eh? My class, because you think that my class is worth more than 100 rupees. Suppose you will get 500 rupees. What do you prefer? Eh? Still you will sit here and learn. That means you are considering my class is worth rupees more than 500 rupees. Thanks. Suppose you are able to get 10,000 rupees. What do you prefer? Now some people, okay, 25,000 rupees. Definitely nobody will be there in this class. This is known as opportunity cost. Okay, so suppose mean opportunity cost for my class sitting in this room is say 1,000 rupees. 20 people are sitting in this class and 20,000 rupees is the cost. Okay, so that is one aspect of the cost conducting. So all these things you have to consider. What is the cost of this auditorium? It is very difficult to calculate because this building has got a large cost involved in this building, this chairs and all. But this chair is not used entirely for my class. This building is not used entirely for my class. A time fraction is used. If that is significant, for example, this classroom, your managers or administrators are giving this classroom for rent. Okay, rent. For 2 hours, they will get a rent of 10,000 rupees. And there are people waiting outside to get this class. Then you have to consider that also as cost. Okay, so many known and unknown, fixed and variable things will be there in the cost. All these things you have to consider in estimating the cost. So cost is something, it is not a static thing, it is a dynamic thing. It is a concept. Cost is a concept. You have to think what are the costs. Then only you will realize that how costly it is. So whenever you are doing an analysis, the cost part is very, very important. So cost is the input and effect is the output that we have already discussed. Costing is the descriptive analysis of costs involved in a program. You can limit your study to costing exercise alone. Okay. You can do a study, an economic evaluation just by costing. Suppose this, what is the name of what is Masters series? What is the cost of conducting Master series? Whether you learn it or not, I am not considering. I want to conduct a master series for 1 year, okay, with 10 lecture classes. I can just study what is the cost involved without studying the outcome at all. Then what will be the type of economic evaluation there? It is a partial or complete. It will be a partial economic evaluation. Okay. So what is the cost of selling alcohol in Kerala? Then I have got an experience when we were invited to study the economic evaluation, not economic evaluation, the health technology assessment in New Delhi. People were given some analysis. They can plan their own analysis as groups. We 2 or 3 people were from Kerala, and we were thinking which economic evaluation, which kind of things that we will do. Then that person, our trainer, who is from Thailand, who come to us, then he asked what you are thinking. Then we told that we are from Kerala. All others are from national university, these institutes. We are only representing a state. So we are isolated. We are in Kerala. Then he is very much interested in Kerala because when you are going outside, Kerala will bring a lot of address or something like because people know about Kerala. Oh, you are from Kerala. He is very happy. Then he just asked us, okay, what is the problem? What is the problem you face? Then we told that we have got large NCD problem and we have got road traffic accidents, mental health issues. So many issues are there. Then he told that, is there any connection link between these things? NCD, high NCD, road traffic accidents and mental health. Those people are very intelligent people. Then we thought, what is the connecting thing? All are 3 different entities. Then he told, no, these are not 3 different entities. This could be connected to alcohol. Because alcohol will do all these 3 things. You do one thing, you do a costing on alcohol. You do not go for a complete economic evaluation at all. What the cost of what alcohol is doing to your society? How many accidents are there? What is the cost of those accidents? How many lives were lost because of alcohol? What is the cost of that thing? Then you will realize that the cost of selling alcohol in your state is very high. and it has got a high policy relevance. Do not go for any complete economic evaluation. So this is a very important thing. Sometimes a very important policy paper will be costing alone. If you just speak about cost, it will speak about, okay, about the problem. Then we told him, okay, we agree, but the problem is we don't have data. How many accidents are happening? We don't have that data. Okay, then he told us, okay, I will do one thing. I know your health secretary personally. I will make a call now and you will get the data immediately. So that whatever data with the health system, you will get it. And you can do the analysis. Then he phoned the health secretary. Then what would have been the response after that, after the call? He come to us and told, better you take another topic. Because what is the problem with if you're costing alcohol, invariably you will find that it involves a lot of societal cost. Okay. And if that study is there with the media or something, the government will be in soup. So government don't want that kind of an analysis conducted scientifically. Okay, just not only in Kerala, it's everywhere. These kinds of things are there. Government policies may not be supporting the costing. Okay. Anyway, so costing itself could be a very good study. And all economic evaluation, both partial and complete, start with costing. Costing is the starting point of any economic evaluation. Okay. So some basic concepts. One is we are interested only in the difference in cost for a partial economic evaluation. In partial economic evaluation, we are interested only in the cost, not in the effectiveness. We are interested in the betterment and outcome in comparison to cost in complete economic evaluation. These are the basic concepts. That is why we are discussing it again and again. Okay. And here we are bringing in another concept. It is the perspective. Whenever you are doing an economic evaluation, you have to clearly state that what is your perspective. There are three perspectives. Okay, one is the person or family's perspective. Second one is the system perspective, and third one is the societal perspective. Societal perspective is the perspective of economic evaluation unless you specified otherwise. Again, you just come to alcoholism. What is a family's perspective? What is the cost of alcoholism in family's perspective? General thing. I am not asking you to assess it quantitatively. You can tell about that one. Is it costly thing? For a family, the alcoholism, is it a costly thing? Yes, it is very costly. Because alcohol is not cheap. Why alcohol is not in GST? Right? Some people argue that government is not bringing alcohol to GST. That is, government want to sell alcohol. That is why they are not putting in GST. Wrong. Why it is not in GST? What is the highest percentage that you can just have in GST? Suppose I have got chakka of 100 rupees. How much GST could be there on that 100 rupee chakka? Among the small kadis, which kadi has got the highest GST? Pazhampuri has got, the banana fry has got highest GST. What is the GST percentage of banana fry? It is 18%. It is 18%. What is the tax on alcohol? Suppose you are, now the Kerala's alcohols are actually very famous nowadays. Okay. I'm not telling the brand because you people may think that I am an alcoholic. But there are so many brands are there. Suppose I am producing a brand, 1 liter bottle, the cost is 1,000 rupees. If I want to sell this, how much money I have to give to the government? The highest GST is 18%. If it is in GST, the highest amount I have to give for per 1 liter of alcohol is 180 rupees. But here, if I want to sell, how much money should be given to the government? At least 1,250 rupees. Okay, 1,000 rupees is the price. What is the tax? 1,250 rupees is the tax. Then what is the total? 2,250 rupees. That is the amount of money somebody has to spend to buy that bottle. That is why it is not GST. Because it is the amount of tax is much more than GST. Okay. So my question is, this much money is spent by the families. Not only the money or the price of that material, the tax is much more than the price. Okay. Then what they are getting? What is the outcome? What they are getting out of the way a person consuming alcohol, giving large amount or spending large amount of money, what he is getting? He is getting some kind of a euphoria. I can convert that maybe in utilitarian terms. Okay, that is a positive thing of alcoholism. What else? He may have a lot of health problems. His liver will be damaged. He may be getting acute gastritis. Almost all organs will be damaged. So that is the bad effect. Then if I am doing a cost effectiveness analysis of consuming alcohol in patient or individual perspective, then what you are going, is it cost effective? Is alcohol is cost effective for an individual? Not at all. Not at all. What about I am not using health system, but system, government. What about the government perspective? They are getting a lot of tax. That is that is actually not the cost, that is the outcome that they are getting. They are getting a lot of money out of that. Okay. So sometimes that may happen to be cost effective for government. That is why, what about the societal perspective? For society, again, a lot of damages, accidents. Okay, so many things, crimes, yes, so many things. So again, it is detrimental. Alcoholism is not cost effective for families, not cost effective for society, but sometimes that may be cost effective for the government. That is why the government is selling alcohol. Okay, so the perspective is very, very important. Most often we are not using the government perspective, but the health system perspective. So whenever you are conducting an economic evaluation, you have to think in which perspective. What the cost the individual or family is incurring, what is the effectiveness or benefit they are getting. That is the family perspective. What is the cost from the health system, what the benefit they are getting. That is the health system perspective. What is the cost spent by the society, what the benefit the society is getting is the societal perspective. Government is spending a lot of money to give medicines for non-communicable diseases. This intervention, if you check the family perspective, that is highly cost effective. Why? They will get medicine free of cost. What is the effect? Their hypertension and diabetes will be controlled and they can live longer. How so much quality could be gained, but the amount of money spent is not that much. They have to go to the primary health center. They have to see the doctor. Sometimes some bus fare may be involved. But other than that they don't want to spend money to see the doctor. They don't want to spend money to buy the medicine. So highly cost effective for people. What about the health system? Even though people are not spending, the health system is spending a lot of money to buy this medicine. Okay. And they are spending a lot of money to post a doctor there, nurse there. So the cost incurred by the health system is huge. What the benefit the health system is getting? Some benefits they are getting. One is if these diabetes people were not treated, okay, the uncontrolled diabetes may go into some kind of myocardial infarction. The government has to spend more money to treat myocardial infarction, okay, than preventing a myocardial infarction by treating diabetes. So that kind of effectiveness is there. But if you just check, there is, you can just something like a tie. The cost is also very high. Effectiveness is also good. So we cannot say that it is how much cost effective it is. Again, the same thing, you just think about the societal perspective. What is the cost of the society? Again, each these individuals are spending money, that is a part of societal cost. Okay. So again, the government is spending a lot of money, that is also part from the society. All the cost should be combined. What the effectiveness the society is getting? The society is getting healthy human resource. Okay. So that may be more cost effective in societal perspective. So the perspective is very, very important, and perspective is a very important concept in all economic evaluation. Whenever you are doing an economic evaluation, you have to mention that this is the perspective. Okay. Which one among these three, which one is the most commonly used and preferred perspective? Which is the most commonly used and preferred perspective? Societal perspective. Okay. But it is very difficult to do. All the cost incurred by the society. That means some DYFI people are coming and helping you. You have to account their cost also. Okay, that is a cost. In Wayanad landslide, the cost is you have to account all human resource cost. If you are accounting it in the societal perspective. But in health system perspective, we won't account them all. Okay, we don't have, which is not very costly at all, because we are not doing anything. The society is doing a lot of things like that. But it is very difficult to do. So you may go for a health system perspective. That is comparatively easy to do, but again somewhat difficulties, because it is very difficult to get data, how much amount of money is spent by the health system. Okay, but it is very easy to do. Which perspective? Which perspective is very easy? The individual or family perspective is very easy to do. You can just have primary data collection in family and you can do it. But you have to keep it in your mind that the cost incurred by the family is the part of the total cost incurred by the society. The effectiveness getting the family is also a part of the total kind of effectiveness getting for the society. Okay. So that is perspective. And another concept is time horizon. Time horizon is another concept that we will study, or we have to keep it in our mind while you are conducting a economic evaluation. Okay. What is time horizon? How much time is included in the study? Sometimes the cost will be a single time cost. Sometimes the cost will be there. For example, a machine that should be repaired again and again. And effectiveness will also be sometimes now the effectiveness will happen, or the outcome will happen after a few months. For example, what is the effectiveness of childhood vaccination? Are you going to see all these effectiveness in 1 year? If the child has taken a pentavalent vaccine during her first year of life, are you going to get the full effectiveness in 1 year? No. What about 2 years? What about 3 years? What about 4 years? What about 5 years? 5 year may be a reasonable thing, because we think that the vaccine preventable diseases are more common within 5 years. So if you are conducting an economic evaluation to study the effectiveness of childhood vaccination, what is the time horizon will like? Maybe 5 years, sometimes 15 years. There should be a logic. Okay? What will happen if you just reduce the time horizon unscientifically? For example, I will I am going to study the effectiveness of childhood vaccination, but I will not consider the outcomes or prevention of diseases after 1 year. What is the finding that you are going to likely to get? The cost won't much change because all vaccines are received within 1 year. The cost is not changed. Effectiveness is yet to come. Then what may be your inference or conclusion? This is not cost effective. I have spent this much amount of money for vaccination, but I could only prevent a few measles, a few diphtheria. So then polio. Then why I want to spend this much amount of money? What is a wrong thing, or what is a mistake I have committed here? I kept the time horizon illogically small because the vaccine will be effective at least 5 years. For a study to find out the economic productivity of vaccination, the time horizon should be at least 5 years. If you can keep 10 years or 15 years, that is good, that is better. Okay. Similarly, based on the situation, you have to. Another thing is your medical college is going to buy an MRI machine. Okay. What will be your time horizon like? Is it going to, the time horizon is for 1 year, or is it for 5 years, or is it for 10 years, or is it for 25 years? 25 year is actually very, because the MRI machine may not last long, that's that much long. Another thing is some newer machines may come because 25 years is a large period. So sometimes at that point of time, you have to discard the MRI machine. So I am not considering 25 years. 25 years is pretty long. But 1 year, because to buy MRI machine, the investment is happening now. But the outcome is going to happen in future years. If you want to really measure how much value for money, you have to consider a time scale or a time horizon, maybe 10 years. There should be a logic. This intervention, what is the effectiveness? When the effectiveness are likely to come? How can I account all these things in my study? And all these things are very, very important in choosing time horizon. So sometimes in some economic evaluation, the time horizon will be the lifetime horizon. For example, what you have learned during your childhood, the cleanliness during your childhood, it will pay you for entire lifetime. So your time horizon will be the lifetime. Okay, so the time horizon is a very, very important concept in economic evaluation. So the costing and effectiveness will be in that time horizon. Costing will be for the entire time horizon. If you are using time horizon as 5 years for childhood vaccination, you have to account the cost for boosters also. Okay, but the effectiveness will be more. But if your time horizon for childhood vaccination is for 1 year, you need not account the cost of the boosters because within 1 year we are not giving any boosters. Okay. So consider the situation. The country A wants to allot the money required for a comprehensive insurance schemes in the next budget. What exercise do you want to suggest? Is it a partial economic evaluation or a complete economic evaluation? Country A wants to allot the money required for comprehensive insurance schemes in the next budget. It's a partial economic evaluation. Basically, it is a costing. How much diseases are likely to happen? How much money may be involved in treating those diseases? And how much is the premium? And all these things are basically you are interested in cost. Okay. The country, second question, the country had a cost of rupees X, but saved Y productive years. Then XYY is rupees 500. What does that mean? Cost of 1 year of productive. നമ്മൾ നേരത്തെ പറഞ്ഞത് ഞാൻ ഒരു റിവിഷന് വേണ്ടി ഇട്ടേക്കുന്നേ ഉള്ളൂ. That is, what is that 500? Total amount of money X. Now there is no insurance scheme. The government is spending X amount of money to have that insurance scheme. By that much money, Y productive life years could be saved. Then X by Y is the cost for one productive life year. What does that mean? എന്നൊരു പേര് നമ്മൾ നേരത്തെ പറഞ്ഞു. That is incremental cost effectiveness ratio. That is ISR. Okay, these are just revisions. Okay, that we will just skip this slide. Okay, because we are moving to some other aspects of health economics rather than from the economic evaluation per se. That is why I skipped both 2 slides. Now we will continue with this one. We just studied the concept of opportunity cost. Okay. In health economic evaluation, we have to consider the cost is the opportunity cost. Okay. There are different types of cost, but in economic evaluation, we are considering the opportunity cost. What is opportunity cost? Conceptually, opportunity cost is a concept. Okay. We will do our maximum to find out what is the opportunity cost, but it is a concept. What is opportunity cost? For a masala dosa, what is the price? 100 rupees. No, 100 rupees. How much will be the cost, excluding the profit of the person selling the masala dosa? That means the cost of the ingredients and the cost of the person who is making masala dosa, not selling. That person that Anyadesha Tolilali is making that masala dosa. Okay. I am not considering the profit of the person, profit of the firm or the restaurant. What will be the cost of a masala dosa? I have it for 100 rupees. What will be the, if I am excluding the profit, what will be the amount? ചുമ്മാ ഇത് പറയാമല്ലോ ഇവിടെ 40, 60, 50 rupees. So just say 50 is the profit and 50 is the cost. I am spending 100 rupees and getting that masala dosa. Okay. You are also spending 100 rupees and getting the masala dosa. Sir is also spending 100 rupees and getting the masala dosa. Okay. Is the cost is same for these 3 people? Is the price is the same? Yes, price is the same. 100, 100, 100. Cost is also the same if you consider 50 rupees is profit, another 50 is the cost for the ingredients. In that aspect, cost is also same. But economic evaluation, we are not considering that cost. But we have to consider the opportunity cost. What is opportunity cost? Opportunity cost is the opportunity missed. Okay? What opportunity missed, or what the costliest opportunity missed to get that masala dosa? Suppose R is a very wealthy person. He had maybe $100 million with him. And what is the cost of masala dosa? What opportunity he missed by getting that masala dosa? Nothing. Okay, here nothing. He had to eat something. At that point of time, he preferred masala dosa. That's all. He could have eaten maybe a chicken biryani. Okay, this masala dosa is not actually his It's just a psychological choice. Okay, there is no, a peanut is spent for that masala dosa. Suppose he is a government employee, okay, then in that context, what would have been, why he chose masala dosa? Because he can afford masala dosa, he can afford biryani, but he cannot afford a buffet. But he could have afforded a buffet. He chose masala dosa only because at that point of time he chose masala dosa. That is all. But here he is considering some other choice. He could have gone for a buffet. Buffet was his choice, but he don't have that much amount of money. But he can have maybe a meal, a biryani, or a masala dosa. But he chose masala dosa. I am a poor person. I don't have money. I have got very little amount of money. I want to spend for my child's education. But now I am very hungry. So I am choosing masala dosa because masala dosa is the cheapest among the choices. Okay, don't think, okay, these are fictitious examples. Don't think that, okay, without masala he could have choose a plain dosa. Okay, he choose a dosa because it is the cheapest. You just philosophically think, whose masala dosa is costly? Eh? My masala dosa is very costly because I am having my masala dosa at the cost of my child's education. He is spending masala dosa at the cost of a biryani. Okay, maybe he could have chosen. Okay, but what he is spending masala dosa without he's spending at all. So even though in one aspect the cost is the same, the opportunity missed, he is not missed any opportunity. Only thing is he's hungry. അല്ലെ മസാല ദോശ കഴിച്ചാൽ പിന്നെ ബുഫേ കഴിക്കാൻ പറ്റത്തില്ല, അതുകൊണ്ട് മാത്രം. അല്ലെങ്കിൽ പുള്ളി ബുഫേ കൂടെ കഴിച്ചാൽ so much amount of money is with him. So this concept, how can you capture this? It's a very important question. That means if a person who is conducting economic evaluation don't ask how much amount of money you have spent in hospital. I spent 100,000 rupees. Then you ask, which are the aspect for medicine? I prefer insulin of this brand. It cost 500 rupees. But the same insulin without this brand is available for 100 rupees. Then the cost is actually 100 rupees. Okay, it is not 500 rupees. Those kinds of analysis should be there when you are doing economic evaluation. Because economic evaluation, what is the basic concept in economic evaluation? Yeah. The resource is scarce. The spending is happening if the resource is really scarce. That is opportunity cost. That means each and every money you are spent and an opportunity of spending in another dimension. If you are able to capture that, it is very difficult to capture this opportunity cost. That is why I mentioned that opportunity cost is a concept. You, in your economic evaluation, you try to capture it. Sometimes ഇതെല്ലാം പറഞ്ഞതിന് ശേഷം നമ്മൾ എന്തായിരിക്കും ചെയ്യുക? We will just, okay, how much amount of money you have spent, we will just write down and calculate. But that maybe you are doing, but conceptually you have to capture the economic, this opportunity cost. This term opportunity cost will appear again and again in economic evaluation. For example, opportunity cost of 1 year, 1 year of productive life. What is the opportunity cost of 1 year productive life? You will get 1 year of productive life. Okay, actually you are going to live 100% productively till your 70th birthday. Then you will be having some diseases. Okay, I will extend it for 1 year. Okay, or today, now, suppose you are very ill now. Okay, you are just bedridden. 1 year you will get in my account. how much money you will give to me for 1 year. നിങ്ങളെ ഉള്ളതേ തരാൻ പറ്റുള്ളൂ. ചുമ്മാ കൺസിഡർ ഐ വിൽ ഗീവ് 5 million. അതോടെ നിങ്ങളെ 5 million ഒന്നുമില്ല എനിക്കറിയാം. How much money you can give? You can give. Just tell me an answer. 1 year of life, how much worth it is for you based on your economic situations? 1 lakh rupees. What about you? 2 lakhs. So, okay, 1 or 2 lakhs rupees. Okay. This, you will get a mean. If I am conducting a survey, I will get a mean. And my mean is 1.5 lakhs. Do you think government of India can spend 1.5 lakhs rupees to gain one productive life year? No. You can spend. Why? This individual. For government of India, they have to think this 1 lakh rupees they can give, spend elsewhere. Okay. So the government of India may not be spending more than 1,000 rupees for 1 year of life of a random person in this country. Okay. Your opportunity cost is 1 lakh rupees, but government of India's opportunity cost is only 1,000 rupees. That is known as a budgetary line that we will discuss later. Okay, opportunity cost is the societal opportunity cost. It is not the individual opportunity cost. In the society you are living, to extend one productive life, how much cost is incurred, how much cost government is able to spend is the health opportunity cost. Usually health opportunity cost will be more in US or less in US compared to India. Opportunity cost for one productive life year. ജീവിതത്തിന് വില കൂടുതലുള്ളത് US-ലാണോ ഇവിടെയാണോ? Where life has got more economic value, not I am valuing my life or not. In which society the life has got more economic value? In wealthy societies. That is why people are conducting clinical trials in poor countries. Because in poor countries, even though there is a possibility of death, people will be willing to participate in a trial for money. Okay. So usually it will be 1 to 3% of per capita GDP. If a country has got high per capita GDP, 1% or 3% of per capita GDP will be very high. Which country has got highest per capita GDP in the world? Which country has got highest per capita GDP in the world? We are using that in Human Developmental Index. That is why one country's economy we are using in calculating Human Developmental Index. It is United Nations of America. US, even still now, US has got the highest per capita GDP. So 3% or 1% of per capita GDP will be maximum in US. That means a human life is maximum valuable in US. The health opportunity cost of one life year is maximum in US. What about our country? What about the per capita GDP in our country? Is it high or low? The total GDP in our country is pretty high. We are the fourth economic power in that terms. But per capita GDP is very low. Because our country is the fourth economic power by virtue of our population, the number of people residing in this country. Our per capita GDP is low. Then what will be the 1% or 3% of per capita GDP? It will be very low. Government, do you think government will put 3% of per capita GDP as the health opportunity cost or 1% of per capita GDP as the health opportunity cost? In India, 1%, because government don't have money. Our society, even though നമ്മൾ blah blah എന്നൊക്കെ പറഞ്ഞാലും, our society is a poor society. So usually we will keep 1% of per capita GDP. That is actually a very small amount. That is our health opportunity cost. That is a value of our one product average, not your life, not her life. It is the average Indian's life. 1 year of life is cheap, but an average European's 1 year of life is costly. So that kind of a difference is there. So that is the meaning of opportunity cost. Conceptually, what is opportunity cost? It is the next best opportunity. At the expense of next best opportunity, you are choosing something. That is opportunity cost. But practically, that is one society, how much amount of money they are able to spend on a productive life year is the health opportunity cost. Okay. Are you okay? ഉറക്കം വരുന്നുണ്ടോ? സാധാരണ ഈ ഉറക്കം വരികയാണെങ്കിലേ എഴുന്നേറ്റ് നിൽക്കുക, എന്നിട്ടിരിക്കുക. പക്ഷേ ഈ ചെയർ ഇറ്റ്സ് നോട്ട് ഗുഡ് ഫോർ പീപ്പിൾ ക്യാൻ ജസ്റ്റ് സ്റ്റാൻഡ് വാക്ക് because no need to sit and just sleep. You can just, because it is not just dry concepts. No opportunity cost in hell, and again, no economic evaluation in heaven and hell. Similarly, no opportunity cost in why there is, what is the opportunity cost in heaven? What is health opportunity cost in heaven? It is very difficult to tell. You cannot. Because in hell, there is in heaven, there is no scarcity. Okay, how much amount of money you can spend? You can spend. That means, in essence, it is infinite. How much amount of money you want to spend for a life? Just get the life. Money is not matter. I will spend infinite. Infinity is the health opportunity cost. Maybe heaven has got high health opportunity cost than US. Okay, what about hell? Health opportunity cost is zero. Because how you cannot spend. If you just think in reverse, some people will think reverse. Cost, how much amount of money I want to spend to save. In that aspect, maybe you can tell that in hell, it is health opportunity cost is infinite. Okay, but usually opportunity cost is high means that much amount of money that society is able to spend for one productive year. Okay. One of the major criticisms of opportunity cost is that it only speaks about economic efficiencies, not equity. Okay. In economic evaluation, one of the major, not only health opportunity cost, the entire economic evaluation, it is not speaking about equity. For example, I am installing a cath lab in Calicut, and I am installing a cath lab in Mananthavadi. Which one may be value for money? In Calicut, already there are 5 cath labs. I am going to install one more. In Mananthavadi, there is no cath lab. Not only in Mananthavadi, for the entire Wayanad, there is no cath lab. Where I want to install a cath lab. Which one will be value for money? Value for money will be the 6th cath lab. If you do an economic evaluation, most often you will have a conclusion that a 6th cath lab in Calicut is more value for money than a 1st cath lab in Mananthavadi. Because people in Calicut will spend more. They will be having more ill health because of having Calicut biryani and all. And there may be more numbers. It's actually a big district with somewhere around 4 million people. Okay, in this Wayanad, there is only total 4, so only 40 lakhs, only 1/10 of Calicut. Tribes, they don't even come. Even if they come, they won't spend. They are not able to spend. They don't have money. So, but if you consider the equity angle, then where you have to build that cath lab? In Wayanad, because that is a single cath lab. Suppose a person is having an MI there, they have to come to Calicut to to do the cardiac catheterization. That is not good. Okay, so equity. We will, in economic evaluation, we will think only in terms of efficiency. We won't think the equity. To consider that we have to consider the health technology assessment. Health technology assessment, we are not only considering the economic efficiency, we will consider other factors, social desirabilities, okay, social desirabilities, equities, and all other things we will consider. Okay. We already discussed this thing, the difference between price and cost. Okay, price means the market rate for exchange and does not necessarily reflect cost. Usually, cost plus profit is the price. Still, that cost is not opportunity cost. Now, you just remember our masala dosha's example. Masala dosha is made up of so much ingredient. Those ingredients has got a cost. So, masala dosha's cost will be the total cost of those ingredients plus the salary of the person who made masala dosha. And maybe the space for that restaurant, maybe that dosha kalli. All these things combined together is the price of the masala dosha. But you are buying it at a more rate. That rate is the price. It is not the cost. Cost plus profit will be the price. But still that cost is not opportunity cost. Opportunity cost is the, according to the perspective of your study, if your perspective is for society, how much money society can spend on masala dosha in a situation of resource scarcity. The society don't have enough money with them. They are buying masala dosha because there is no other go. If that is a situation, how much money could be spent by the society, or how much money, how much the society will be willing to spend for a masala dosha, that is opportunity cost. Okay, so that you have, that concept should be very, very clear. For a personal perspective or a family perspective, depending upon the financial situation of that family, how much the family is willing to spend for a masala dosha is the opportunity cost for masala dosha in the family perspective. How much the society is willing to spend for 1 year of productive life. How much the health system is willing to spend for 1 year of productive life is the opportunity cost of the 1 year of productive life for the health system. But usually we will do it for the society. For society, we will consider the whole country as a unit, and that is usually we are using that as the opportunity cost. Now we know what is the concept of opportunity cost, as well as we know how we can easily calculate the opportunity cost. Okay. So all these things are some part of the other health economics. For example, the healthcare market is never perfectly competitive and the price cannot be identical to cost, and all other things we will discuss later, because some other aspects of health economics will also come in this slide. So cost and perspective also we have already discussed. So to save time, because cost will change depending upon the perspective. So when you are going to have an intervention, for example, I want to study the cost effectiveness of the master class series. Okay, master class series. What is the comparison? What is the comparison here? There is no class. Okay, no class versus master class. No class means no cost, no benefit. Okay, but master class, you are actually bringing in some cost and you are expecting some benefits also. So you have to measure the cost and you have to measure the benefit. Similarly, your management is have a discussion with you, and you have to choose whether they have to buy a cath lab or they want to install a നമ്മുടെ സ്ഥിര എക്സാമ്പിൾ അല്ലേ the dialysis unit. Okay, first you have to work out the cost for installing the cath lab. Then you have to work out the cost of installing a cath lab. What will be the cost for installing a cath lab? First, you have to find out a space. That space has got a cost. There will be a construction. That construction should have a cost. Machines have a cost. People are working there. They have got a cost. Okay. If you are considering the societal perspective, people coming to the cath lab for investigation, that has also a cost. You have to think. You have to sit together, think about the cost. All the cost should be listed down. Okay, sometimes that may be the first time you will be recognizing that the cost has got these kinds of dimension. Don't think that the cost effectiveness analysis, just like you have got a tool or a questionnaire to assess cost, that questionnaire should be developed by yourself. And the questionnaire should be validated by yourself. How can you validate that questionnaire? It is basically a content validation. You can show it to the experts. Or is it okay? Are you identifying any new costs? Okay. Or you want to discard or reduce some amount of the head? Are you finding some other alternative? Do you want to suggest something? If you have got that kind of a discussion with the so-called experts, who will be the experts in if you are having a costing analysis in cath lab? People who are running cath labs. Okay, people coming from the units or the machines, that people will be there. People have expertise in costing will be there. So you can conduct a modified Delphi kind of thing, and you can find out the cost structure and put a questionnaire. Then you can assess the cost. The same kind of analysis will be done for your installing your dialysis unit also. Okay. So you have to, this is the basic things that you have to consider while you are studying about cost. Some are fixed cost and some are variable cost. What is the difference between fixed cost and variable cost? The cost for that infrastructure is a fixed cost. The cost used for the gloves or used for the apron, that is a variable cost. Okay, that means when each and every person is going to the cath lab, the variable cost will vary. There will be some variable cost. But fixed cost, suppose a person is going to cath lab and spending 2 hours in cath lab, the cost share from the fixed cost for that person will be less compared to another person spending 5 hours in the cath lab. Fixed cost is there, but depending upon the time and facilities used by a person, okay, that will vary. How can I know that, okay, this much share of fixed cost will be incurred in this? One thing is you can conduct some studies. For example, in other cath labs, you can see what is happening there, how much time is spent by each and every patient, or from literature you can get that. Anyway, there are cost structure you have to consider. Fixed cost. Fixed costs are just for land, maybe infrastructure and all other things. Variable costs are just for each and every unit you have got some variable cost. What about direct cost and indirect cost? Direct cost means money is directly involved. Money is directly involved is the direct cost. What is indirect cost? That may be in terms of some other time. For example, time. Time is actually money. Okay. He is spending 2 hours. A doctor is spending 2 hours. Then you have from the doctor's salary, you have to check what is the cost of his 2 hours. So that is an indirect cost. So there are direct cost, there are indirect cost. What is average cost? Three terms are very important. Total cost, average cost, and incremental cost. Sometimes people will think about marginal cost also. Today we are not discussing the concept of marginal cost, but marginal cost is something related to the incremental cost. Because if I am bringing in more terms, it will confuse you more. What is total cost? Total cost. Total cost. Okay. Okay. You add all the cost, then you will get the total cost of installing a cath lab. What is average cost? If that cath lab is taking care of 1,000 individuals, total divided by 1,000, you will get average cost. That means for a unit, what is the cost involved? That is the average cost. What is incremental cost? So, ഇവിടെ കിടപ്പുണ്ടത് marginal cost versus incremental cost. Marginal cost means how the cost will change. What is happening? For example, if any change in cost is the marginal. For example, if the system is fixed, any change in cost is the marginal cost. For example, you think about cath lab. The cath lab is fully functional. Okay, first patient is coming and it incurred a cost. Second patient is also coming, then the cost will increase. Okay, but the cost will increase very slightly because you need not have a separate machine for the second person. The machine is already there. You need not have a separate space for the second person. The first person coming for MRI, second person is also coming for MRI. The same MRI machine is used. But some cost difference will be there. The technician has to spend more time. Sometimes the gloves should be used. That area should be cleaned. So some cost is involved, but that is not that much big. Suppose your firm is becoming large and large. Maximum amount of patients treated or handled by a unit is 500. Now that maximum achieved. 500 patients are there. What about the 501st person? If the 501st person comes, what you will do? Every day you are getting more than 500 patients. 500 is the maximum you can tolerate. What you can do? What you can do? One option is you will just exhibit a board that 501st person cannot be given the treatment. But there is a cost. Because that person is coming to you because he do not know whether he is the 501st person or 499th person. He will come to you and he is recognizing that the service cannot be done. So he has to go to some other place. So that incurred a cost. And again, sometimes the indirect cost is also there. People will say that, okay, those people will take care only 500. Sometimes you will be the 501 person. You may not be given the service. Please don't go there. There are another center where thousands of people could be tackled. Then what your management can do? Can provide service for the 501st person. How can I give service for the 501st person? Only by installing a new unit. Then the cost, you just look at from 500, from 1 to 500, the cost, marginal cost is very minimal. But from the 500 to 501, the marginal cost is jumped. So these kinds of the cost for any increment or any not use that term increment, a cost and in margin or cost in change, cost related to change is known as marginal cost. But what is incremental cost? So that much important for you, but incremental cost is important for you. Incremental cost is if you have got two choices. what is the additional cost for the second choice compared to the first choice? What is your two choices in our previous example? Cath lab and dialysis. Okay, which one is more costly? The cath lab എന്ന് വിചാരിക്കൂ. Then the difference between dialysis unit and cath lab, the cost difference between dialysis unit and cath lab is incremental cost. In a sense, that is a type of marginal cost. Cost is changing, okay, but it is not from a unit to another, but the cost is changing from one intervention to another. It is the cost difference between two interventions. Incremental cost is the cost difference between two intervention. Okay, that is in. So you know what is total cost, you know what is average cost, you know what is incremental cost. Incremental cost is very, very important in all economic evaluation, especially complete economic evaluation. Okay, that is incremental cost. There are sunk cost, depreciation cost. Depreciation cost is inflation. Okay, depreciation cost means I do not know exactly what sunk cost is. I got the slides from elsewhere. I forget to edit. You have to, then that you can consider as a homework. Okay, you just check what is sunk cost. Okay, depreciation cost means because of depreciation in money that we will discuss maybe in the next slide. Direct cost, indirect cost that we have already, sunk cost താഴെ കിടപ്പുണ്ടല്ലേ, cost that has already been incurred but cannot be recovered. Okay, that is sunk cost, it is lost. Okay. This depreciation, this is not depreciation, discounting is not depreciation. Okay, before discussing discounting, we are discussing depreciation. What is depreciation? Depreciation is you have to account inflation of money in your economic evaluation. Okay, you are feeling that there is some additional cost is involved because just because of inflation is depreciation. For example, last year 1 kilogram of apple was worth rupees 200. Now it is 250. If that 50 rupees increase only because of the the change in value of Indian rupee, that additional cost is depreciation cost in terms of money. Otherwise, there is, for materials, there is something called a depreciation. For example, like car and insurance, in first year, you will be having more money to spend, or you will get more money if the car has got damaged. The second year, you won't get that money. That means if you have got an MRI machine, in the first year, that cost, for example, one MRI machine is functional for 10 years. The cost of MRI machine is 1 crore. The cost of one MRI machine is 1 crore. That will work for 10 years. What will be the cost of MRI machine per year? Suppose there is no need of repair. It is going to function as in a good condition for 10 years. Total amount of rupees is 1 crore. We bought it in 2000 AD. Okay. Then what is the cost of that MRI machine in first year? What is the cost of an MRI machine in second year? One thing is you divide it by 10. Then you will get 10 lakhs. Then you can say that the cost of MRI machine is 10 lakhs in 10 lakh first year, 10 lakh second year, 10 lakh third year. But on the 10th year, what is that MRI machine? That MRI machine is a 10-year-old MRI machine. But now it is a fresh MRI machine. That means this is not a good way of doing it. Rather, in first year, it is not 10 lakh rupees. I will put 10 lakh and maybe 12 lakh or 13 lakh. Second year, I will have a reduction. Third year, I will have again a reduction. That is the depreciation cost. Depreciation cost will make the first year more costly. first patients more costly because they are using a fresh machine. Okay, then there will be some issues with the MRI machine also. The film may not be that much clear when it was running the 8th year. That is why we have to account all these things. Okay, the money inflation can also be accounted in because doing economic evaluation is not an easy thing because the cost structure involve all these nitty-gritties. For example, the cost now I am spending 100 rupees. Okay, now the value of 100 rupees may be equal to the value of 150 rupees after 10 years. How can I know that 150 rupees in 2010 is equal to 100 rupees in 2000? How can I know? Usually people fix an year. Whenever you are studying or reading an economic evaluation, they will say that we are using this monetary term. It could be US dollars. US dollars is the most preferred currency in all economic evaluation. But even you can use Indian rupee. If you are addressing an international audience, for example, if you want to publish a paper and the international audience should read, better you convert it to US dollars. So US dollars is the preferred currency. Okay. Then you have to make a statement that I am using the purchasable parity of US dollars on January 2025 for the whole economic evaluation. If I am making that statement, what does that mean? I am converting all cost to the money value of US dollars in January of 2025. How can I do that? Because I am going to spend some money in January 2025 itself. There is no issues. I can directly compute that. But how can I convert the amount of money I have spent in 2026? How can I convert the amount of money that I am going to convert in 2027 to that 2025? How can I do that? Yes, there will be standard methods for that. US dollar will be having an inflation. Okay, that inflation we will account in our economic evaluation. That means the amount of money you are going to spend in 2027 should be converted using the inflation factor to 2025 January. Okay, that exercise you have to do while you are conducting an economic evaluation. This is one thing. Second issue is the inflation will be different in different materials. Okay. And sometimes the cost structure will be different in different materials, which is the most fluctuating cost. A cost which is very sensitive. Maybe sensitive to seasons, sensitive to time. വില മാറിക്കൊണ്ടേയിരിക്കുന്ന സാധനം എന്തോ സ്വർണം എന്ന് പറയരുത് സ്വർണം ഓക്കെ സ്വർണം ഈസ് റൈറ്റ് ബട്ട് ഇറ്റ് ഈസ് ഫുഡ്. Okay, food materials will change its cost. You cannot have what is the standard price of masala dosa. There is no standard price for masala dosa. What is the standard price of apple? There is no standard price for apple. So some people argue that you should not consider food materials. Yeah, everything. So tomato, onion, all these things. In some season, 1 kilogram of tomato will be 20 rupees. In another season, sometimes the 1 kilogram of tomato can be 2000 rupees. Okay. Even if it is not 2000, maybe 250 rupees. So it can change. So non-food items. Then you can just assure that this is purchasable parity of US dollars for non-food items in. So that will just give some more values that your cost is actually something credible. It is not sensitive to changes. Okay, that is one way. And this is another important concept, that is discounting. Okay, discounting, people may think that this is adjusting for inflation. This is not adjusting for inflation. This is actually something else. Okay, What is discounting? Discounting is the process of adjusting future costs and health outcomes to their present values. Discounting is for cost and discounting for the benefit. But both has what? Reverse direction. Okay? I am going to give you a biryani. Okay, biryani. I am going to give you a good Kozhikodan biryani. When you prefer it. Okay? Now or tomorrow. People will prefer now. Because we do not know what is going to happen tomorrow. Tomorrow we may not be there to have biryani. Okay? But thing is, you have to give that money back to me. When you will give that money, today or tomorrow? She want biryani now, but she will give the money tomorrow. This is something called a preference. So this is the money you spent now is more valuable than the money you spend tomorrow. But the benefit you are getting now is more valuable than the benefit that you are getting tomorrow. Okay? The money you spend now is more costly than the money you spend tomorrow. But the benefit you get now is more beneficial than the benefit that you are going to get tomorrow. You have to address this issue also. Okay? Usually, it is not for a single day, but per year, sometimes you will have a small account. There are some studies, what is really the discounting rate and all. Usually people give 2 or 3%. Okay. That means now 1,000 rupees, if it's spent today, it worth rupees 1,000. But if you are going to spend next year, it is 3% less. That means 30 rupees less for today. Spending 1,000 rupees in 2026 is only spending to 970 rupees today. The 30 rupees is in discount because of the time preference. Either you can spend 970 rupees now, or you can spend 1,000 rupees next year. Next, spending 1,000 rupees next year is only spending 970 rupees today. This is 3% discounting. Okay, that is discounting. The reasons for discounting only is time preference of people, just like she mentioned. Another is opportunity cost. Opportunity cost will also change. You know what is opportunity cost? What is the context of opportunity cost? You don't have the money now. If I can spend it tomorrow, I can use this money for other things. It's actually a big relief for me. Every day I am actually trying to make both ends meet. That is a resource-less condition. So now it is very difficult for me to find out resource. Tomorrow also it will be very difficult, but it is just tomorrow. Today I can spend to some other interventions. So I can just postpone it. That may be the reason. So that is also should be considered. So here is this is I think this is the last slide in costing that we will stop here. Here you have to consider the cost structure. Whenever you are comparing two interventions, you have to consider total cost structure. It could be direct cost, indirect cost. Okay, all these things you have to consider, and you have to fix a monetary value that could be US dollars or it could be Indian rupee for a time, and any change you have to convert back to the original thing, that fixed thing. Then only you can directly compare things. There is something called your discounting. Usually 2% or 3% is given as discounting. Okay, these are the things that we have already discussed. and we discussed about opportunity cost. That is a very important thing. That is the heart of costing in economic evaluation. The opportunity cost. Opportunity cost is basically how much amount of money the society is willing to spend to save 1 year of productive life. That is opportunity cost for a quality. Okay.
Thank you so much, Anish sir, for that clear, thought-provoking and deeply informative session. Your ability to simplify complex economic principles and connect them to real-world public health challenges has truly added value to this masterclass series. Malabar Medical College Hospital and Research Center extend our sincere thanks to all the participants for your active engagement, thoughtful questions and continued support. The success of this series reflected in the great response to session 1 and today's session is because of your enthusiasm. We look forward to welcoming you all again for the upcoming sessions in the Health Economics Masterclass series. Till then, stay curious, stay connected, and thank you once again.